Tiffany?
I am.
Very nice to meet you.
Nice to meet
I'm
you.
Dr. Chang. All right, nice to meet you, Tiffany. Welcome to the practice again. I actually just like to first ask, how did you hear about us? Awesome. Well, glad that worked out and glad you were able to find us there. And again, welcome. So as part of this consultation, we're going to do a couple of things. I'm going to go over your medical history just to be sure that we are cleared from that standpoint, to be sure that you will be safe on any of these medication options. And then we'll spend some more time going into a deep dive for how these medications work and how our program works. All right, so let's jump into it. So basically we have two different medications that we use here in the practice. One is called Semaglutide, the other is called Tirzeptide. There are different branded versions of these out on the market, but it is important to know that we do obtain our medications through the specialty compound pharmacies. So basically we are utilizing compounded Semaglutide or compounded Tirzeptide. Functionally, these medications are very similar to each other, but there are some key differences that you should be aware of. Mainly, Tirzeptide is a dual receptor medication as opposed to a single receptor medication. It is a little bit stronger and more potent when it comes to the weight loss effects. And interestingly though, we kind of learned this through practice, that Tirzeptide tends to have less negative side effects for most people as well. So despite it being kind of the stronger, more potent medications, most people in general do tolerate it much better than the Semaglutide. The other difference to be aware of is that there is a little gap in the cost of the medications themselves. So Tirzeptide in general is the slightly more expensive option, but we have some different packages that we can actually talk through and go over when you're ready to do so. All right, so let's talk about potential side effects. First, it's important to note that not everybody gets negative side effects, but if you do, there are some common ones to kind of watch out for, namely those being primarily nausea or vomiting if it's kind of bad enough, constipation or diarrhea, heartburn is possible as well, and then I would say a little bit less commonly headache and fatigue. But that list that I just gave, those are probably the most common of the initial side effects. All right, and there's a few practice level recommendations that we have to help minimize or mitigate any potential for side effects. And so there's actually just some basic steps to follow while you're doing this. Number one, you want to make sure that you hydrate well every day, get plenty of water, increase your protein intake, and actually for a lot of people it helps increase fiber intake as well. And then very simply just try to get 3 small meals throughout the day, with healthy snacks in between. That way we're kind of supporting your metabolism and also trying to get to your body all the necessary and required nutrients. All right, so how do these medications work? So no super magic to it. I do like to tell people that number one, there is an appetite and craving suppression effect that kind of happens here in the brain. Number two, you get a fullness sensation that happens in the stomach. That happens primarily from a mechanism called delayed gastric emptying. All that means is that it takes longer for foods and liquids to kind of pass through the stomach. So by extension, you end up feeling full faster and you feel full longer. So again, just to summarize that, kind of appetite control here, satiety control here in the stomach. There is a third property to be aware of, and that is that both these medications can provide basically some enhanced sugar regulation properties. What I mean by that is they will help basically minimize sugar spikes in the body by sending signals to your pancreas to produce more insulin whenever you are consuming sugars. And so that's kind of how that sugar regulation property happens. All right, the medications are injections and you take them once a week. Typically when you start, we will get you your first injection here in the office. That way we can show you and teach you how to do them. The majority of our folks do end up self-injecting at home afterwards, but if you ever have any questions, you are always welcome to come back to the office, no appointment needed, and we can help inject for you. Once you get started, we do end up seeing you every month, and that is actually an intentional check-in that we're providing for you. It's a way to kind of see how are things going, how are you feeling, are you having any negative side effects, and then also checking in if any other new medical things are going on or anything else that we need to talk about. So we use those monthly check-ins basically to then help you determine any dosing adjustments as needed. All right, a question that I get pretty frequently is if you start Semaglutide and later want to switch to Tirzeptide, can you do so? And the short answer is yes, definitely. We do use these medications somewhat interchangeably in that sense. And it can go the other way too. If you start tirzepatide, you can always switch to semaglutide. So in that way, there's a lot of flexibility that's sort of built in here, as well as this idea of having a backup option in case for any reason you run into too many side effects with one medication, or run into basically like a plateau effect and are just not getting the results that you're looking for. In terms of, are these medications effective? The short answer is yes. There's lots of medical data out there, and at this point we have a lot of practice experience to demonstrate this. I'm more than happy to share that with you. If you have questions, I can give you some numbers to kind of look at. But we have had really, really great success with this so far, and are really, really fortunate to be able to offer this to our patients. All right, in terms of injection locations, I would say most of our folks do end up injecting somewhere in their belly, probably 95% or more. But that being said, you always have other options too. So you can do the side of the arm, or even in the thigh, basically anywhere that you've got some fatty tissue that you can get to pretty easily. I do recommend, as you get going and as you're doing these injections, that you alternate side to side each week. And the other question that kind of comes up a lot is there a specific time of day, and do I need to do this with or without food? And the short answer to all that is no, there's no specific time of day. You can inject anytime that works out for your schedule. You don't necessarily have to take it with food. It's totally okay. Some people, if they do get a little bit of nausea or a little bit of fatigue with the injections, some people do prefer injecting in the evenings. But kind of short of that scenario, really any time of day is fine.